Mental illness, also known as mental disorders or psychiatric disorders, refers to a wide range of conditions that affect a person's thinking, emotion, mood, behavior, and overall mental well-being. This condition can cause significant distress and impairment in various aspects of an individual's life, including their ability to function, maintain relationships, and perform daily activities. So, mental illnesses are not a result of personal weakness or character flaws. Rather, they are complex medical conditions that can have both biological and environmental causes. Factors such as genetics, brain chemistry, traumatic life events, childhood experiences, and social influences can contribute to the development of mental illnesses. So, based on a technical report released by our Health Ministry in December 2017, as much as 29.2% of adults, which is age 16 and above, or 1 in 3 adults, and 12.1% of children in Malaysia are experiencing mental health problems. There are numerous types of mental illnesses, each with its own specific symptoms and diagnostic criteria. Some common examples including depression. Depression is characterized by persistent feelings of sadness, hopelessness, and loss of interest in activities that were once pleasurable. Next, we have anxiety disorders. Anxiety disorders is including conditions like generalized anxiety disorder, panic disorder, social anxiety disorders, and phobias, which involve excessive and uncontrollable worry and fear. And bipolar disorder. Bipolar disorder involves cycles of mood swing ranging from episodes of elevated manic mood to periods of deep depression. We have schizophrenia, which is a severe mental disorder that affects a person's perception of reality, thinking, emotions, and behavior. Next, we have a post-traumatic stress disorder, or we call it as PTSD. PTSD is develops after experiencing or witnessing a traumatic event and is characterized by intrusive memories, flashback, and emotional distress. And then we have the obsessive compulsive disorder, which is OCD. OCD is marked by recurring intrusive thoughts, which is obsession, and repetitive behavior as mental acts, or we call it as compulsions that perform to alleviate anxiety. And the last one, we have the attention deficit, or we call it as hyperactivity disorder, or the other name is ADHD. ADHD is a neurodevelopmental disorder that affects attention, impulse control, and hyperactivity. Some mental illnesses can vary in severity and duration, and their impact on individuals' lives can range from mild to severe. Treatment approaches typically involve a combination of psychotherapy or medication and support from health mental professionals and loved ones. Early intervention and appropriate management can help individuals manage symptoms and improve their overall quality of life. It is important to seek help from qualified professionals if someone is experiencing symptoms of mental illness or if you suspect you or someone else might be affected. So, the symptoms of mental illness can vary widely depending on the specific disorder, its severity, and individual differences. However, there are some common signs and symptoms that may indicate the presence of mental health condition. It is essential to remember that experiencing some of these symptoms does not necessarily mean a person has a mental illness, as many factors can contribute to temporary changes in mental well-being. A mental health professional is best qualified to diagnose and treat mental illnesses. Here are some general symptoms of mental illness. The first one is changes in mood, which is persistent feelings of sadness and hopelessness, indicative of depression. And then extreme mood swing from euphoria to deep sadness, indicative of bipolar disorder. And intense and uncontrolled anxiety or panic attack, indicative of anxiety disorder. And we have changes in thinking, which is difficulty concentrating or making decisions. Disorganized thinking or difficulty communicating logically is very common in schizophrenia. And intrusive and uncontrollable thoughts, which is obsession or repetitive behavior in OCD. Next, we have the changes in behavior. Changes in behavior included social withdrawal or isolation, changes in eating habits, either overeating or undereating, and substance abuse or engaging in risky behavior. To add more, we have changes in sleep patterns, which is insomnia or sleeping too much. And the last one is lack of interest or enjoyment. So lack of interest or enjoyment is losing interest in activities that were once pleasurable, and decreased motivation and engagement in daily life. So it is crucial to note that everyone's experience with mental health is unique, and not everyone will exhibit all of these symptoms, even if they have a mental health condition. Additionally, some of these symptoms may be due to other factors, such as physical health issues or temporary stress. If you or someone you know is experiencing persistent and distressing symptoms that interfere with daily life, it is essential to seek professional help from a mental health provider for an accurate diagnosis and appropriate treatment. Early intervention can significantly improve the outcome for individuals living with mental illness. So for preventing mental illness involves adopting a proactive approach to maintaining good mental health and well-being. While not all mental illnesses can be completely prevented, there are several steps individuals can take to reduce their risk and promote better mental health. Here are some strategies to consider, which is maintain a healthy lifestyle. You can eat a balanced diet, which is a nutritious diet can positively impact mood and overall well-being. Try to exercise regularly, which is physical activity is linked to improve mood and reduce stress. And get enough sleep. You need to prioritize quality sleep to support mental and emotional resilience. The second one is you need to manage your stress. Develop healthy coping mechanism. You can engage in activities that help you relax and manage your stress, such as yoga or hobbies that you enjoy. And the last one, seek professional support. Regular mental health checkup, just as you will visit a doctor for physical health. Consider seeing a mental health professional to monitor your mental well-being. So in conclusion, mental illness is a complex and diverse set of conditions that can significantly impact an individual's thought, emotion, behavior, and overall well-being. It encompasses a wide range of disorders, each with its own unique symptoms and challenges. Mental illnesses are not a sign of weakness or character flaws. They are legitimate medical conditions with biological, psychological, and social components. Factors such as genetic, brain chemistry, life experiences, and environmental influences play a role in their development. Thank you very much.